If you've ever had shoulder pain that just keeps coming back, even after rest or workouts, this video is for you. I'm John Fox, a licensed physical therapist with over 25 years of experience. I also served 10 years in the United States Navy as a corpsman, where I completed my undergraduate physical therapy training. I'm originally trained in the United States, currently living here in the Philippines. I will be filming these episodes from different locations around the country, starting here on the beautiful island of Siquijor. On this channel, I break down common injuries and movement dysfunctions, why they develop over time, and how to restore healthy movement. Today, we are going to talk about the shoulder, one of the most misunderstood joints of the body. I'm here with Sean, the owner of Siquijor Sunset Glamping Village. We're using his gym today to look at his long-standing history of bilateral shoulder pain and dysfunction, something that's very common in athletes and non-athletes alike. Using his shoulder as an example, I'll show you how these dysfunctions develop over time and what actually helps. We'll talk about posture, movement habits, training mistakes, and why treating only pain often fails. Ready? So the first thing I'm going to look at is how rigid you are through here, if we can get some actual movement going this way. So common sense would say if gravity's pulling us this way, we want to try to do some things to go into what's called extension. So I'm going to try to help him develop a little bit of extension. It's just some common mobilization techniques, just gentle movement through here, and see how stiff he is. And he's a little stiff, not as bad as I would have thought, not too bad. So I think it's kind of a simple remedy, easy fix to try to get some movement in here. And we've really got to strengthen these muscles here called the rhomboids, or your thoracic extenders, or your scap stabilizers and your scap retractors. So the upper traps, the rhomboids, the lower traps, and all the muscles that kind of bring these shoulder blades together is going to be really important when it comes to exercise. So for right now, we'll just do a little bit of extension moves, and I'll be right back with you. Again, all you massage therapists out there, make sure your position is good. If you're doing this all day, every day, we don't want to have you as a patient. So getting good position and using good technique is very key. You'll see I'm in a good position here. I'm not using a lot of effort. And I like to use this thumb over the spot and then this hand to come over the top to give the pressure. That gives relief on my body a little bit. The last thing you want to do is use your thumbs like this. That puts a lot of strain on them. All right, let's dig into these guys here. Sean's favorite spot. Again, knees bent, good head up, good posture, arms extended. Very little effort on my end. So right now I'm trying to do some techniques to kind of release these muscles. They're working extra hard to hold on to his head and to hold on to his shoulders from falling forward even more. But common misconception is to release these muscles and just let them go. Then it's going to allow you to fall even further forward. So it's good to release them, get some of the tension out. But it's also really important that after you do all this, you go straight into some strengthening and postural positioning so that it maintains those releases that you've made, and you can strengthen these positions and not allow just to fall forward even more. So we'll be talking about that in just a minute. Ready to say now? All right, Sean, so we talked a little bit about posture. Did some things to help you open up here. I want to show you a little trick against this wall. Come on over here. You're going to stand and put your feet, your head, your shoulders, and back all against the wall and try to hold this position right here. It's a lot harder than you think because you're here. It's going to be like this. We're going to try to work on that every day though. So go ahead and get back there. I want your heels against the wall first. Good. Back all the way against the wall, your head against the wall. Keep your chin down if you can. Down. There we go. Arms up. Let's just do this since your shoulders are bad. Just hold that position. You feel that stretch already? Yeah. Just try to hold that every day. Chin down a little more and keep that head back. So you can see it's hard for him to keep his chin down and back because he's got that little bit of a rounded shoulder thing going on and that little kyphotic thoracic spine. We're going to work on that. That's going to be huge. That'll really help over time. That's probably good. But that's a good exercise right there. Try to get up every morning, stretch a little, and then see if we can't get you against that wall flat and hold it for about a minute every day before you start your workout. All right. So before we get started and try to do some free motion exercises and manual therapy techniques, we're going to just check how much you can move your arm now. So I want you to take both arms and just go up as high as you can naturally. That's already better with the little muscle release we did for sure. You can see though, he's kind of doing a little bit of this at the end. So what we want is him to be able to be here. So drop these scapular bones and use the muscles to retract and depress the scapula while you elevate, and that'll give you more freedom of motion. So that's kind of what we're going to work on as we lay down. One more time, I want you to just come out to the side and try to clap your hands over your head like that. And you notice he comes forward a little bit. He does pretty good, does pretty good, does pretty good. As it gets tight, he comes forward a little bit. So we want to really try to work on opening this part up. That's going to be our functional movement that we're going to do. Yeah, well, that comes with strength. And as you get more freedom of motion, it's going to be easier to hold it longer because you're not fighting against yourself. Let's lay on your back. Head up here, on your back. Head up here. And we're going to focus on the right shoulder today, since that's the one that bothers you the most. But I want to do a comparative note, so we got to see both. One of the things I always is mandatory for me, if you're going to lay on your back, if you want to sit like that with your knees bent, you already naturally do it. That's good. The worst thing you can do is put your legs straight though and arch your back. So since you're already laying like that, we'll leave it alone. But for those of you out there that treat people, or if you're treating yourself, when you're laying on your back and you want to get some release of tension through here, make sure there's always something under your knees. Make sure you always kind of bend your knees and have something so that you don't go into a tilt while you're laying there, and that usually causes your feet to roll out to the side and all sorts of other problems. But you're in a decent position now with your knees bent. We'll leave you alone. So first I'm going to check the affected side, and ideally I'd have this table about this height so that I don't have to bend over, but instead I'll just get my legs working a little bit and I'll get down to him. But the worst thing you could do is be here and treat. If you're a therapist or you're somebody that works with patients, make sure you protect yourself first. So go ahead and totally relax. Let that arm fall. Let it fall. Let me have it. Good. So I want to get him to totally let go of that so that joint's free to move. And we're just going to kind of just do some gentle mobilizations here. And he's really forward, so I'm trying to push it back and down. Because he does up and forward, I'm going to try to go opposite of that, back and down. So we're going to do a little bit of posterior glides or backwards glides, and inferior glides or downward glides. That should just feel good naturally, and it immediately wants to come back up. So he's got what's called a high riding humerus. It's very common in dysfunction of the shoulders. So instead of just kind of forcing his motion up, it's really important that we get a natural glide and roll, and we create space there. So again, as he elevates right now, things are kind of riding high. He's hitting the top of his scapular bone, which is called the acromion, and it's forcing things up. We want to get a glide and a roll. So I'm doing mobs to kind of make the joint do this and allow him to come up naturally with a little glide and roll. And that will give you more motion. So that's the objective here. And there's exercises we're going to show you at the end that can help emphasize that as well. And as I do this, you can't see it. If you walk around over here, you'll see that this is starting to pop out. He's getting a little scapular winging. So as I get this to stay down, there's always something that it wants to compensate. And you can see this pop out as I do that. So I'm holding him down here, everything's good, and boom, he gets a little scapular winging. So what we can do is get him under here, hold here, and you'll feel a little stretch in that posterior capsule and that inferior capsule. And do some glides this way as well. You all right?
Yeah.
Feel that stretch?
I can.
Good. We're just going to hold that and give it a good long stretch. Again, I'm using my legs and not my back. I'm not bent over. My back's straight. I'm using a lot of legs because this table's a little bit low for me, but that's all right. And we'll give you a good 30-second stretch here. Yeah, you feel that.
I feel that.
Doing a good job of relaxing. If they're fighting you, you need to get them to release a little bit and relax. You don't want to fight them. Shouldn't be a battle. He's doing a great job of relaxing everything in there. And then you'll really feel the true stretch. Okay, go up. And now you've got a lot more freedom of motion, yeah? Yep, his head's back a little bit better, so we've got some thoracic extension. Let's go try that position against the wall again. I know it's tough. And then try to get here with both hands. Bend your elbows down and back. So that's a little hard for you, so we're just going to go here.
Okay.
Good. Head down, there. And just hold that position. Tilt your head this way a little bit. So we want perfect posture, and chin down. There, right there. Hold that. 30 seconds. Great exercise right there. So for all of you out there that have posture questions, this is a great position for you to get in to try to check your posture. If you're going to get in against the wall, try to get everything to touch. You're not like this. You're not like this. And once you get there, you can take a step away and hold it, and that's where you want to be. So we got about 5 seconds left. 2, 1, get that chin down. Get that chin down. That's not bad too. I like that. You can bring it up here and work on range. I just don't want you to elevate the shoulders too. So he's still elevating. If you can get it here, that's fine. He's a little elevated. Get the chin down. Bring the shoulders down slowly. Yeah. Bring your hands down by your side. Keep that chin back. Everything down, 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 down. Chin down. Good. Now, hold that position. Don't move. Take a step forward. Take it a little more forward. Don't lean back. Stand up nice and straight. Good. And then I'll take a deep breath in. Let it out. Now, open your eyes and look in the mirror. That's the position you want to try to keep yourself in all day, every day. If you find yourself out of that position, try to get back up against the wall and try to really work on that. Over time, you'll make like structural changes. You can make plastic changes, but too much gravity wins, especially in sitting. We get like this and we get commonplace here. Yeah. It's very important that we sit straight up. I always say if you hold a weight like this, I can sit and hold this weight, no problem, all day long. Everything's lined up. If I try to hold the weight like this, this is going to be killing me after about 5 minutes. So do I want to be here or do I want to be here? So your head weighs about 10 pounds. This is about 5 pounds. If you're holding 10 pounds all day like this, it's going to work your shoulders and your upper back and neck. So it's very important to have good posture. All right. Let's work on a couple little simple exercises. This is our first exercise. So we'll use the wall. I love using the wall. You can bring your feet out this time and lean into it though. So let me demonstrate real quick. I want you to be here, lean into the mirror, and a little bit of a knee bend. So now it's easier to get good posture with I have the knee bend, the feet out. It's a lot easier to get in this position than it is if I'm here. And it's a little more functional. We spend more time in our power move if we're here. If I'm playing a sport or if I'm doing anything active, I want to be in this position more than I want to be in this position. So we'll get in what we call the functional neutral. Get here. I'm going to have you grab these bands from about here. And the first exercise we're going to do is just bring it and bring your hands against the wall and make sure the band comes right across the middle of your chest. And when I do that, if I come away from the wall, you can do it away from the wall as long as you keep good posture, is you get here. It's better against the wall until you feel like you can hold it. I like it against the wall even if you can. But I'm using this to demonstrate when I do that, I'm working these muscles here that are responsible for pinch your shoulder blades. Sit up straight, head back, pinch these shoulder blades. So there, those muscles are responsible for pinching your shoulder blades. When you get elevation, it's very important that you have scapular retraction while you do that. If you want good posture, you don't want to let your shoulder blades go like this. You want to make sure you keep them pinned up against your rib cage. So this exercise is very good at strengthening these guys. When these guys are weak, they allow you to fall forward. So common sense would be let's strengthen them so we can go the other way. So I'm going to show you 3 different exercises right now that we can do to strengthen that muscle group.
You're gonna send me that video later?
Yeah, I'll send you all of this.
I can remember.
So again, against the wall, bring your feet out and lean into it. There you go. Trust the wall. It's there for you. Arms straight out. Good. And a little bit wider. Yeah. Keep your head against the mirror. And now try to bring this all the way out and touch your chest and then back. Keep your head up. Good position. Good. You want to touch the middle of your chest. Don't go into your neck. Good. Keep those arms straight. And back. Let's do 5 more. 1. Good. That's it. 2. Good. Now we're working your rhomboids and your scapular retractors. That's what we want. 3. 2 more. 4. And 1 more. 5. Good. That's a good one. Attaboy. All right. I like it. The overachiever. All right. Let's go 4 more then. 3, 2, 9, and 10. Good. All right. Take a little breather. Ready? All right, so I'm going to show you a total of 4 different exercises. We showed you the 1. Now I'm going to show you number 2, which is, it's 2 motions, but you're going to just take your hands and go this way instead. Maybe a little wider grip because it's a little harder to do this one. We're going to go up 1, 2, let's do 10 this way. And then we'll turn your hands and go 10 this way. But again, my head doesn't move. I'm not using my motion. Everything's real still and just shoulders up. And doing this, and then do 10 each way. So let's try that. Get against the wall. Same thing we did before. It's called the functional neutral position. Bring your legs out and bend your knees. Good. Head and back against the wall. Hold this a little bit wider, right? Maybe a little closer, little hands closer, right there. Good. Arms straight out again. And now we'll just tilt it. Keep the head straight though. You don't turn your head sideways. And go all the way. Try to touch your chest. 1. Let's go. A little higher with that right arm. 2. 3. Lower with the left arm. 4. 5 more. You got this. 6. 7. 8. 2 more. Keep that head straight. 9. 1 more. Come on. You got this. And 10. Good. Take a break. Woo. Right here. Video me. All right, as Sean makes his way over here, I'm going to show you the last 2 exercises. This is basically focusing on the rotator cuff. So today we worked on posture, we worked on scapular retraction and how to open up the thoracic spine and how important that part is. Now, the most neglected muscle group in the shoulder for sure is the rotator cuff. And this is something a lot of people don't do or they don't do it correctly. So I'm going to demonstrate from maybe over here. Is it lighting okay? I'm going to demonstrate first internal rotation. Again, a good position. I like keeping my core turned on, like someone's going to punch me in the stomach. My head's in good position. I don't want to be here because then I'm strengthening a bad position. I want to strengthen a good position. We just did all these exercises and stretches to open this up. Now let's strengthen that good position. So we're going to get here and internal rotation. You start here, just touch your belly button. You come in kind of quick, but then back nice and slow, eccentrically. Concentric in, eccentric out. And we'll do 10 on this arm. And then I'm going to have you flip around and we'll do 10 on the other arm. Let's go. This is internal rotation.
They say the negatives. The negative is good.
The negative is more important. That's called eccentrics. So get yourself in that good position. Knees slightly bent, head up, shoulders back, pinch. Good. Now go and touch your belly button. 1. Good. Back slow. In quick, back slow. That looks great. 3. There you go. Yeah, you can move away or closer depending on how much tension you want to give yourself and resistance you want to give yourself. Sean took a step away because he's feeling frisky and strong. This elevated shoulder we want to get down, so bring this shoulder down. Keep your head back up. There you go.
Where can I hold my left hand?
Try to bring, it doesn't matter. Try to bring this shoulder blade down and closer to your spine. Think of doing this while you do that. There you go, that's better. Even if you have to get closer, yeah, and make it easier on yourself. Keep that head up. Keep that head up. There you go, right there. Good, so position is very important. You don't just go through the motions. Let's do 1 more. Good, now switch and do the other arm. Yeah, you do. So this is our 4th of 5th of 5 exercises. So this is our 4th one. Oh, you're better on this side for sure. So his rotator cuff is definitely involved on his right shoulder. Probably got a tear still in there that he's dealing with and functioning through. A lot of people can work through it without doing any surgery, but these are the exercises you want to do if you want to be able to manage a rotator cuff tear, a shoulder that you don't want to get surgery on. Keep everything real still. Let's do 3 more. 1, 2, and 3. Good. Exercise. I always like to end up with external rotation.
Copyrights on the
You get copyright. Yep. You can share it and do it whatever you want with it. So now we're going to do the last one. We're going to start at the belly button and go external rotation. So you don't need to go very far. I see a lot of people try to twist and go way out here. You don't need to do that. You just want to come here to neutral. So we're going to start. This is going to be hard for you. I think you have a tear in your external rotators. But let's try it with the right shoulder here, good position, and just try to go out a little bit. If it's too hard, get a little closer. And we're just going this far. Hold it, and then back slow. Out quick, hold it, back slow. Let's see what you got.
I want these 5, huh? When you finish.
Yep, yeah, for sure, 100%. I'm going to do a quick one at the end, and we'll send that to Instagram. So start, face her a little bit.
I knew this.
Start here.
I knew this was going to be hard.
And we'll help you out, and then back slow. So what you can do if you're working out by yourself, take your other hand here, put it right here, and help yourself out. I know, but I'll just show for the viewers.
Okay.
Keep your elbow tucked. If you're having a hard time, you can help yourself out. Now let go of the left, hold it with the right, and then go back with just the right. So you can go out with both and then back with just the one. Keep that head up. We're worrying about posture at all times. Keep that elbow tucked in here. Right there, now go. See, so help it with the left. And then right. Oh, okay, you're not going to. He's stubborn. 3, 4, 5 more. Let's go. Head up. 6, 7. Keep that elbow bent. 8, 9. One more. Attaboy. There we go. Good. So he's got a rotator cuff tear to his external rotator. My guess is the infraspinatus is the most common one to have it. And you can see he has a real struggle getting there. So over time, that will scar down, and you can strengthen the components to it, and you can see that improve. But if you do those 5 exercises,
That's what I want
the
to
one
do.
against the wall is 1.
When I do my shoulder.
This one is 2. This one would be 3. This one is 4, and going out is 5. You can do those 5
You
band
think I should
exercises
do every day or just do when I do
every other
shoulder
day. Every other day at the
Because I do
most.
chest.
See, your arm is straightening. You don't want it straight. You want, look at mine, stays bent the whole time. So get that elbow in, right there. Touch your belly button. Go away from the treadmill. There we go. Elbow, start at the belly button. Your fist touch your belly button.
Oh, okay.
Right there, and now just come touch here. There you go. That's the exercise. That's it. 2. Head up. 3, 4, 5 more. 6. Attaboy. 7. This one's not as bad. 8. Keep that elbow in. 9. It's hard to do. And 10. So his rotator cuffs either torn or just very weak. So we got to work on that. So we'll work on it. Good job. Thank you, Sean.
Thank you,
It's been
John.
a pleasure. Yep. Sunset,
And thank
Tiki
you.
Horse Sunset Glamping Village. Make sure you come here for your stay. The food is the best on the island. The gym is the best gym in the island. And the staff that you have here and the owner are the best people on the island. So love collaborating.
What about
If this sounds familiar and you'd like deeper guidance, eventually I'll be releasing structured online protocols for different injuries and conditions. For now, please like, subscribe, and follow along. New topics every week.